Hello everyone, welcome to Dr TSR channel. So today let us study about mechanism of labor. Right? This is the pelvis and I want a baby. So when they give you the baby, first keep the placenta in the abdomen. Then we want universal flexion attitude. So flex both the hands and then flex both the lower limb, right? So this is universal flexion attitude. Okay, then coming to the skull, fetal skull, I didn't cover the fetal skull actually. So fetal skull, we have transverse diameter and oblique diameter. When they give fetal skull, remember you have to hold and show through the foramen magnum. So you have to catch the skull through foramen magnum. Okay, so coming to the fetal skull here, see, you have transverse diameter, that is biparietal diameter, distance between two parietal bone 9.5 centimeter. Then comes sub and super, super or subparietal bone, that is one side below the parietal bone, another is above the parietal bone, or another is below and here it is above, that is sub or super parietal bone, that is 8.5 centimeter. Then comes bitemporal diameter, that is a transverse diameter. So bitemporal diameter is 8 centimeter. Then comes the bimastoid diameter, which is again 7.5 centimeter. This is transverse diameter of fetal skull. Then coming to the epidiameter, when the head is well flexed, the diameter which comes is occipito, suboccipito bregma. Bregma is the anterior fontanelle. See, this is bregma. Okay, this is suboccipit. So when the head is well flexed, what you get is suboccipitobregmatic diameter, which comes in the epidiameter, and head is delivers by epidiameter. Okay, so the mechanism I will teach. Now we just learn the epidiameters, four things, that is suboccipito, and here comes the bregma. Sorry, suboccipitobregmatic diameter. When the head is deflexed in military position, what you get is from occipito frontal bone. Okay, so remember again, when well flexed we get suboccipitobregmatic. When it is deflexed, what you get is occipitofrontal. Okay, occipitofrontal. When it is partially extended, what you get is mento vertical. When it is partially extended, what you get is mento vertical. When it is completely extended, what you get is submentobregmatic, that is face presentation. Okay, this is what is the anteroposterior diameter. I repeat again, when it is head completely flexed, what we get is suboccipitobregmatic diameter. When the head is deflexed, we get occipitofrontal. When the head is partially extended, what you get is mento-vertical. When the head is completely extended, we get submento-bregmatic. So remember, 9.5 centimeters in obscene gynae is submento-bregmatic, suboccipitobregmatic, and biparietal diameter, that is the transverse diameter. These are the three 9.5 centimeters in obscene gynae. Okay, other than this, in fetal skull they will ask something about the fontanelles, that is bregma, and here comes the lambdoid. So bregma is the diamond shaped structure made up, it connects the four sutures, that is here two coronal sutures, and comes the sagittal suture, and here comes the frontal suture, frontal, coronal and sagittal suture. That is a bregma, which is a diamond shaped, and it closes by 18 months, whereas behind lambda it closes by posterior fontanelle, closes by 2 to 3 months. And this posterior fontanelle is triangular shaped. It is made up, it connects three sutures. One is sagittal suture. Okay, then comes the two lambdoid suture, sagittal suture and the two lambdoid sutures. Okay, so that is about fetal skull. They will ask like that about the fetal skull. Then coming to the mechanism of labor, you have to tell under these headings. First is lie. Lie is longitudinal. Then comes presentation. Presentation is cephalic. Then comes presenting part. Presenting part is vertex. Okay. Then the attitude is complete flexion of the baby. Then comes denominator. Denominator is occiput. Then comes the position. Position, what is the most common position? It is right occipitotransverse. Okay, so that is right occipitotransverse, means our posterior fontanelle, whatever is there, which is towards the right left occipital transverse, it is towards the left side of the pelvis. Okay, so this is about the engaging diameter. So now comes head engagement. Engagement is when the maximum transverse diameter, that is the biparietal diameter. I told in inlet transverse diameter is more. So head engages in the transverse diameter. So the biparietal diameter comes and engages, crosses the pelvic brim. That is engagement. Then comes the descent and flexion. Descent and flexion is a continuous process throughout the labor because of the uterine contraction. Okay, and the floor contains what muscle? Levator ani muscle. So whenever there is a contraction, so it causes straightening of the fetal body, so that the uterine contraction from here, from the podalic, directly transfer through the spine to that of the cephalic bone, that is the head. Okay, so through it and from the descent, and then comes the aggravated flexion, descent flexion, the head, it try to rotates along the direction of the levator ani muscle. Whatever touches the levator ani floor muscle, it moves along its direction. So from the engagement, descent, flexion, there occurs internal rotation. See, internal rotation is our head should come in the anterior posterior diameter. So it comes, it rotates and comes in the anterior sagittal suture, comes in the AP diameter. See here, when it is something like that, when it rotates, there is a twist. When it's left occipital transverse, when it rotates, there is 2/8 of the circle. But if it is in the left occipital anterior, when it rotates, it is only 1/8 of the circle. Okay, if it is transverse, it is 2/8 of the circle. If it is left occipital anterior, it is 1/8 of the circle. Okay, when the head rotates, then again through the descent and the flexion, head starts to come out of the outlet, right? So when that is called crowning. Crowning is when the maximum transverse diameter, it stretches the pelvic outlet. So the scalp is visible without separating the labia majora, and it will not recede in between the contraction. Okay, now the crowning happens and head delivers by extension. Okay, so head delivers by extension. So they will ask, what are the parts which comes first? First is the occiput, right? Then occiput, then comes the vertex. After vertex, you comes the brow. After brow, you comes the face. So occiput, then comes the vertex, then comes the brow, then comes the face. That's how head delivers by extension. When head delivers by extension, it falls down. So when it falls down, then it undergoes restitution. There was a twist now, so the twist has to change. So it undergoes restitution. So now the shoulder has come in oblique diameter. Now the shoulder wants to come in AP diameter, right? So the shoulder will rotate like this and head will rotate like this. That is external rotation. The shoulder inside will rotate to AP diameter and head externally rotates from oblique diameter to transverse, its original position. So the external rotation happens, the head the occiput lies towards the mother left side. So when this happens, the shoulder has come in the AP diameter, and now the posterior shoulder, it delivers first from the sacral hollow. The posterior shoulder, which has a space, it comes first. Then comes the anterior shoulder, which is hitched under the pubic symphysis. It will be rotated. So then comes the rest of the baby. It delivers by lateral flexion. So the rest of the baby is delivers by lateral flexion. This is about normal mechanism of labor. So the cardinal movements are engagement, descent, flexion, internal rotation, extension, restitution, external rotation, and lateral flexion. Okay, thank you. Please like and share and subscribe. Thank you.